Just because you're lean, thin and looking muscular does not mean that you cannot get cardiovascular disease or heart attack. This is what we saw in our previous video. So what are the tests that we have to check? Lipid profile. It consists of LDL, VLDL, HDL, total cholesterol and triglycerides. Along with that, one more important cardiovascular disease risk marker is Apo B100. These are the things that we have to check. When do we have to go give blood? Early morning in fasting state. That is better. After you have had food in the postprandial state, the levels of triglycerides were found to be fluctuating in blood. That is, they become very high and then they fall down. So this will become an error in judgment of your risk for cardiovascular disease. What is Apo B100? It is a protein, carrier protein that carries LDL and VLDL in blood because these two fat particles cannot be directly transported in water. So this carries that in the core and goes and gives it to the cells. We are already checking LDL levels, which is the causative factor for atherosclerosis. Why do we have to check Apo B100? Because there is a specific type of LDL which is high dense, that has low amount of cholesterol, high amount of triglycerides, not detected in regular tests for LDL, which is a main causative factor for atherosclerosis. How do we detect it? Is by detecting the molecule that carries it, that can be easily measured in blood. That's why we have to check Apo B100 levels. For example, you can have a normal level of LDL in blood and still have high risk for cardiovascular disease. So if you're just checking your LDL levels, you might not even know. You might think that everything is normal. That's why we have to specifically check for these markers. So now you know why we have to do the tests, what tests we have to do and when we have to do it. Thank you.